Hello guys, this is Montago Marchese and I decided to make this video because I want to share something a little bit clever. I mean, it's very normal for her condition, but the thing is, this is her first time, so she doesn't have any idea about changes to herself as a pregnant woman. So I have this close friend who'd ask me about pregnancy, knowing that I am a student nurse. Definitely we've studied about changes in pregnancy. And it's kind of funny because we're both excited for her baby. So I tried to explain and rationalize the physiological and psychological changes to her body so that I can lessen her work. So this is how I explained to her. Let's go guys! So, hi Christine, I'm here to explain to you the common changes to your body as a pregnant woman. So, pregnancy is associated with normal psychological and physiological changes that assist fetal survival as well as preparation for labor. So, it is important or it is crucial to know what normal parameters of change are to diagnose and manage common medical problems of pregnancy such as hypertension, gestational diabetes, anemia, and hyperthyroidism. So, as a result of normal physiological change, normal ranges for certain blood tests are different in pregnancy and women may have different susceptibility to medication. So, I have here a video for you to understand well what I'm talking about. So, let's watch together the video.
Yeah, come on, Jade, you can do it! Push! Push!
I'm pushing! Don't pull it so hard!
Oh, you're almost there. Just a little bit more, Jade. Just a little bit more. I can see it coming out.
Yeah! The last chips. It's worth the pain.
When a sperm and egg join and implant in a uterus, a pregnancy has begun. A human pregnancy lasts approximately 40 weeks from the first day of the pregnant person's last menstrual period. A pregnancy is divided into 3 segments called trimesters. Each trimester includes some common symptoms and milestones. During the first trimester, from week 1 through week 12, a pregnant person may experience morning sickness. Morning sickness can cause nausea and vomiting. For some, it happens in the morning. But for others, they may feel nauseous all day long. Eating dry crackers such as saltines can ease the nausea. Other symptoms of pregnancy during the first trimester include feeling tired, becoming sensitive to certain smells, craving particular foods, experiencing swollen or tender breasts, and needing to urinate or pee more frequently than usual. The second trimester of pregnancy begins in week 13 and runs through week 26. By the beginning of this trimester, most fetuses will have grown to about the size of a peach and will weigh approximately 1 ounce. At this stage of pregnancy, a healthcare professional often can tell the sex of the fetus with some degree of certainty. During this trimester, a pregnant person will gain a noticeable amount of weight. They may also experience nasal congestion, dizzy spells, leg cramps, groin pain, or backaches. Many pregnant people also begin to develop dark patches on the skin of their abdomen or face. These spots usually fade after giving birth. It is during this trimester, usually between the 16th and the 25th week, that a pregnant person may begin to feel movement inside their uterus. By the end of this trimester, the fetus will have grown to about the size of a cantaloupe and will weigh a little more than 1 pound. The third trimester begins in week 27 and lasts until the person gives birth, which is usually around the 40th week. In this, the last trimester of pregnancy, the fetus grows rapidly, gaining weight and developing each week. This stage of pregnancy may cause discomfort for the pregnant person as the uterus stretches even further to accommodate the growing fetus. The pregnant person also may experience shortness of breath and heartburn and may find that they have trouble sleeping. In this, the third trimester, some people experience false contractions or cramps. These are practice contractions, known as Braxton Hicks contractions. True labor contractions usually begin a few weeks or days before childbirth. They are more regular and more predictable than Braxton Hicks, and they grow closer together and stronger over time. Strong regular contractions are a sign that labor has begun. Once in labor, the pregnant person, along with their healthcare provider, will determine if they can have a vaginal birth. During a vaginal birth, the uterus contracts to push the baby out through the cervix, down the vaginal canal, and out the vaginal opening. If a vaginal birth is not what is best for the baby or the pregnant person, a healthcare provider can do a cesarean section or C-section. A C-section is a surgery during which the baby is taken out through the pregnant person's abdomen. Once the baby is born, the umbilical cord is cut, separating the baby from the parent for the very first time. This doesn't hurt the baby or their parent. The place where the umbilical cord was attached to the baby eventually becomes their belly button. Isn't the human body amazing?
Till next time, don't forget to visit me at amaze.org or go to my YouTube channel to watch more. Bye!
So Christine, I hope you learned more about the video or about the stages in pregnancy, and I hope it would help you for your pregnancy or for your journey. And I hope that baby would be healthy as same as you. So I wish I could see you soon, and I wish I would meet your baby. So thank you, and thank you for your time, and God bless.